Good afternoon, and thank you as always for joining us to share some friendly reminders as we look ahead to the upcoming 2022 holiday season. I understand that many of you have seen our preliminary data for influenza and for RSV for this year, and I wanted to offer a few observations. Number one, influenza continues to be on the rise. This is not unlike prior years at this time of the year. But I will say that influenza is rising at a rate that is not typical for November. Normally we see these sorts of numbers and the rate of rise that we're seeing right now later in the year, more toward the end of December or early January. I think this is the case for a number of reasons. Number one is that we haven't really seen an influenza season here in the Monroe County area for the last 2 years. Largely because of the precautions that we were taking due to the COVID-19 pandemic. So we are anticipating, as I've said in the past, an earlier and perhaps a more severe influenza season this year. The other observation I want to offer is that the RSV numbers are on the rise. You may have seen a doubling of the numbers of RSV in previous weeks. This past week, we saw a slight decline, which is in some sense reassuring. But I do want to caution everybody to remember that 1 week does not exactly signify a trend. So in general, RSV numbers are far greater than they are for influenza. I hope that this is a trend that will continue, but I think it's too early to say if that is the case. And I will point out, unfortunately, that we've had 3 people in our community succumb to RSV infection. These individuals were all older than 65, and there is no RSV vaccine, as many of you know. So this is certainly something that we want to pay attention to, and especially so as we look into the holiday season. So with that in mind, we have holidays right around the corner. I think it's a timely time to remind everybody that it's important to get your vaccines. For influenza especially, for the bivalent COVID vaccine if you're eligible. And make sure you do that as soon as possible. We know that the influenza vaccine can take about 2 weeks, 10 days to 2 weeks to become effective. So certainly will be effective in time for the December holidays, but it's never a bad thing to get them as soon as you possibly can because they may indeed offer some protection even as we look toward the end of this week. I think it's important to consider that if you or somebody in your family is sick with symptoms, to reconsider how you are going to have your holiday gathering. If it's possible to reschedule, certainly that's an option. I understand that often it's not an option to reschedule. So this is where the old tried and true advice still holds. Wear your mask indoors, certainly if somebody is ill, if that person can't stay home for whatever reason. Consider those outdoor gatherings, consider spacing, consider ventilation as we had in prior years. But I think this year, the most important thing to do is to remember that if you're symptomatic, to really reconsider your plans. For COVID-19, as many people know, you may not have symptoms and be positive. It never hurts to take a COVID-19 test just to make sure, especially if you're going to be gathering with other relatives or friends who may have some medical risk factors that would make it difficult for them to get COVID, flu, or RSV. Hand washing still very important. Make sure you wash your hands before and after meals, before and after food prep. And again, if it's possible to have some of those events outdoors, consider some of the spacing that we've talked about in previous years. I think that would be prudent as well. I also want to take the opportunity to remind you that the county has its Healthy Holidays initiative underway. You will be seeing advertisements throughout the public, billboards, on the sides of buses and bus stands, all with the intent of keeping everybody healthy so that we can enjoy the upcoming holiday season. So with that, I'm going to turn it back over to Julie and be happy to take your questions.
Thanks, Dr. Mendoza. First up is Spectrum. Do you have any questions? Spectrum does not. So let's go to News 8.
Well, people who are 64 and older, 65 and older, are more likely to have chronic medical conditions. That's not always the case, but certainly anybody who does is at greater risk. Anybody with a chronic pulmonary condition like COPD or asthma would be at greater risk. But in general, this is not unlike any other condition that we see in the later years. People who are older don't have the same ability to come back from illnesses like we did when we were younger. But there isn't anybody in particular, demographically at least, other than age, who's at greater risk above 65.
Okay, Raquel Stephen from WXXI. Do you have any questions?
Yes, hi, Dr. Mendoza. My question is, do we anticipate a spike after the holiday season, after the gatherings, Thanksgiving gathering, and are the hospitals prepared for what could be, or if there is a spike, are hospitals prepared for that?
Well, I hope we don't see a spike. The spike relies on preventing a spike would rely on all of us doing everything we can to prevent the spread of infection of all of these infections throughout the holidays. You know, if there is a spike, I think the hospitals are prepared for it. I think they're certainly anticipating it. It's certainly something we don't want to see, but I think the reality is in previous years, we have seen increases in numbers following times when there are more gatherings. So I think it wouldn't be surprising if we saw the same thing now. But I think what we need to pay attention to are spikes among those who are likely to be hospitalized. So that's why I think it's very important to keep those people in mind, people who are older, people who are under the age of 1 or 2, younger. Those are the people that we want to protect because they're the ones who are most likely to be hospitalized if they were to contract any of these infections. I think if we do all of those things collectively as a community, we would do everything we can to prevent any more surges in our hospitals.
That's all I have, Julie. Thanks.
Okay, thanks, Raquel. Anyone on from WHEC? And how about 13 WHAM?
Yes, I guess, Dr. Mendoza, can you kind of talk about, I guess, from the medical community response right now to RSV and what you guys are seeing? I'm sure it's, I know we profiled a piece last week with the AC6 unit at Strawn in terms of them trying to help alleviate some of the stress from the pediatric offices. But I guess, do you foresee kind of any, from a county response here, do you kind of foresee any movement to kind of help address the needs or maybe alleviate some of the workload from those that are in the medical community who are seeing patients with RSV at the moment?
Sure. No, I'll say that from the county perspective, you know, I believe that we're doing as much as we can right now. We don't have the ability, I don't have the ability to necessarily impact the hospitals directly. I think they are doing everything that they can. But I think the county response at this point is adequate. We've been in contact with the hospital systems, both RRH and UR Medicine, to understand their demands. We are working very closely with the hospitals to try to alleviate that ALC patient backlog, where we have patients who are ready to be discharged, who are able to go to a nursing home bed were it available. I think that's the most important thing that the county can do right now to alleviate some of that stress in the hospitals. But I think from the standpoint of all of us in the community, I think what we need to do is try to take care of one another and prevent people from getting sick. RSV is here in much greater numbers right now than influenza, just on a sheer volume standpoint. And there is no vaccine for RSV. So that's the sort of thing that we all need to pitch in and do our part to keep everybody healthy and safe. I would say that if you are a parent or if you yourself have concerns, pick up the phone first. I would not necessarily go to the ER or urgent care or to your PCP's office just yet. Some of these offices may be experiencing more backlog than others. So if you have a PCP, please reach out to them and get some advice as to how, depending on the time of day, day of the week, how to manage that. But I think we're in for a long winter, particularly if we don't do everything we can to keep each other healthy and safe.
Is there, I know you've touched on a lot of talking points here so far with the holidays and best practices for folks. Is there, obviously there is that factor, I think, for anybody, I'm sure you can vouch for it, is you know, the COVID fatigue and the fatigue of sharing the same message over and over again here. Is there something you could say to folks that maybe hearing again the same, you know, best practices here, we all want to, you know, be together, we all want to be healthier, going through the holidays here. Is there an overarching message you could share, or wisdom you could pass on to folks who, you know?
We've been through so much in the last 2.5 years, and the last thing anybody wants to hear is that we're not at the end yet. But the reality is we're not at the end yet. COVID numbers may be on the decline, which is a good thing. But one of the consequences of all pandemics is that there may be a resurgence in other pathogens, and that's what we're seeing right now. So influenza, RSV are here in greater force than they are in previous years. And that's just the reality. You know, nobody wants to have to share this news, but the reality is that is what it is. Nobody wants to hear the message of wearing a mask again. But I think we can all say, looking back, that wearing a mask is what protected us from flu and COVID for the last 2.5 years. So if you are potentially somebody who is at greater risk, I would strongly encourage you to wear a mask. If you are going to be gathering with somebody who is at greater risk, again, encourage you to wear a mask. It's everybody's choice. But the reality is that, you know, we all can take our own health into our own hands. And I think wearing a mask, getting a vaccine, being thoughtful about who we're gathering with and how we're gathering is still prudent advice. And I understand that people are tired of it. You know, I think we in the medical community are tired also, but we don't have the option of throwing up our hands and saying, you know, we're all done. You know, we're here to take care of our public and our patients. And, you know, I think we all can do our part to try to get through this holiday and into the next year.
Thank you, Dr. Mendoza. Didn't have another question after that. Thank you.
All right, thank you, Dr. Mendoza. That's it for questions. Everybody have a happy holiday.
Thanks all. Happy holidays.